If everybody's ready, I think we'll just go ahead and get started. Thank you everyone for joining us on this Thursday afternoon for another installment of our monthly reports and updates series, where we have the opportunity to highlight efforts across the state working to disentangle mental health in the criminal justice system. My name is Adam Goss. I'm a project manager at Mental Health Colorado. At Mental Health Colorado, we believe in the philosophy of care not cuffs, meaning persons with mental health needs should be met with supportive care rather than punitive measures. Today, we're going to be featuring SAFER, which is a housing program in Arapahoe County. It's an initiative that I actually have the opportunity to work in support of, and is fiscally sponsored by Mental Health Colorado. SAFER is a true example of care not cuffs in action and actively works to protect vulnerable individuals from justice involvement and housing instability. So this afternoon, I'm joined by SAFER's Executive Director, Gina Schimmel, and the Assistant ED, Jen Enquist. As far as questions for the presentation, please feel free to drop questions in the chat so that we can address those at the end, or feel free to jump on live once we get to the question segment at the end of the presentation. And just as a preface, none of us are on the clinical staff. So if you have any clinical specific questions, we unfortunately won't be able to answer those today, but we'd be happy to follow up with any answers. So with that, let me just go ahead and share my screen and I will pass it over to Gina here just a moment. Cool. How's that look?
And you're going to promote the slides, aren't you, Adam?
Yep, I got the slides.
Okay. Thanks. I'll shut us down if you let me do it. So let me do some introductions for myself. So I'm Gina Schimmel. I am one of the co-founders of SAFER. I just briefly, quickie background is I'm a retired dyed-in-the-wool public defender from the city of St. Louis, as well as almost 20 years here in Arapahoe County, Colorado. I have a background of starting our mental health court in the 18th Judicial District and then helping Aurora Municipal Court as well, start their mental health court. Both those projects have a housing component to it, different in nature to serve their needs. And I also serve on a legislative task force for people with mental health involved in the criminal and juvenile justice system, specifically on their housing subcommittee. So I was approached in 20 by a firefighter in our jurisdiction from South Metro. Arapahoe County outside of Aurora does not have a shelter. And we were, because of new laws, we're releasing people in the middle of the night in inclement weather. We did not have the data to support applying for grants for a shelter project. So the firefighter, who's by the name, as I'll give him credit for the start of this whole thing, is Brian Viech, approached me and said, how do we do that? Myself, I connived another defense attorney, and Brian and I literally started putting money out of our own pockets just to start sheltering people in a motel setting, just so we could get the numbers to say how many we were actually saying no to. Literally within 3 weeks, COVID hit. Our jail went from 1,100 plus to 600. And we knew from our research and our legislative endeavors that somewhere between 150 to 200 plus were going to be people with severe mental health issues. Our program started, I can go into the details another time if people need, we were underneath a small nonprofit of the county in April of 2020, where we were able to get several United Way grants to solely shelter our people at the motel, nothing else. We were 100% volunteer with multiple other volunteer entities that are part of Change the Trend Network in our Tri-Cities area that aided us in supporting them. In April of 21, we were literally knowing our people needed by far more help than what we were doing. And as a volunteer basis, we had a peer entity join us That entity has now evolved into a group that we work with multiple peer entities right now. But in 2021, we had one particular peer entity we worked with. We knew that living in a hotel situation for our shelter was not clearly ideal and not meeting the needs of our high needs people. At that time, we had been working underneath United Way CARES dollar with All Health Network, who was our awesome partner at that time, and it still is. But when we were needing to go into the housing arena, they say, go for it, Gina. We just are not at this time having the bandwidth to go to housing. That's in June of 2021 when Mental Health Colorado graciously adopted us, became our fiscal sponsor and advocate for us, where we were able to obtain an emergency shelter COVID grant that allowed us for the first time to start building some infrastructure in our program. That entailed a clinical staff, case management, supportive services, and peer support as well. We also began doing HMIS as well as doing VI SPDATs on our people. We learned a lot during that process. And so come a year later, we really knew we needed to start looking at acquiring our own place and also changing from a hotel model to literally not just sheltering, but transitional bridge housing to other programs. And we did that through data, through constantly applying for multiple grants and learning along the way. And by November of this year, we had our critical piece to that endeavor, and that was literally us getting housing focused for next steps, getting a housing navigator, and in our workforce shortage arena, those are very hard to come by. So we ended up seeking and getting funds to train our team to become supportive housing service givers, as well as landlord recruiters. And what does that look like? And that's kind of where we're at now in terms of going forward, truly trying to grow to the next step housing for our people. Next slide, please. These are our partners that we operate with, and there are many depths underneath each of these entities that we work with. So All Health, from their ACT team and their Bridges program, which is their competency program, to nonprofits that are in our Tri-Cities and our whole Arapahoe County area. Largely, they filter through Movement 52, a nonprofit that is a very aggressive and robust street outreach. So they are the entities that really are referring a lot of individuals to us literally off the street. We also collaborate with multiple peer groups, peer coach groups, peer entities that refer to us, South Metro, and we are expanding that to first responders. It's not on our slide, but we're trying to, in the beginning, we did a lot of one-night stays for our first responders. And that's another endeavor that hopefully we will be able to return to, but we just did not have the bandwidth to respond 24/7 to somebody coming in the middle of the night. Our program is not a stereotype shelter. We are a program that comes by application, and I'll get into that. But our other partners that refer directly to us are the Arapahoe County Public Defender's Office. We have outreached, and now we're being asked by the Prosecutor's Diversion Program to also be partnering with them. Most private attorneys and the Public Defender's Office have their own social workers. That's where the Defense Forensic Social Worker line comes in. We have always had a very good and robust relationship with our pretrial office, which is an entity underneath our county. The pretrial office is not only supervising our people on the criminal justice arena, but they also have a pretrial mental health unit where we get a substantial number of referrals from their program, and then Aurora Mental Health Center. There are a lot more partners, but these are our major partners in terms of referring. One of the things that I'd like to address is the referral process. Is there a slide on that? Or is that just this one, Adam?
It's just this one. Are you talking about the eligibility criteria?
Yep. We're good. So we are not a stereotype shelter at this point. We began that way, and it was truly a lot of wraparound services and support that we did not have on a volunteer basis. We in the beginning and still do some cold weather sheltering and things like that when we have space availability. But generally speaking, our process is on a referral basis from these partners. It is an application. The criteria is basically single adults that are homeless with connections to Arapahoe County that have mental health or co-occurring issues and justice involved or at risk of justice involvement. We have additional criteria in that they have to be suitable and can be safely housed in a motel setting. And we use the broad terminology of you have to have control of your mouth, body, and attitude. We are not an assisted living and cannot provide those services. So they have to at least be able to take care of basic needs. And the individual has to be able to want to move forward and address the obstacles they have to their next step up housing. We do have some no's. Because of where we are presently, we are not allowed, because of our MOU with the hotel that we are in, allowed to have sex offenders. They have other programs with young women and children. And anybody who has an extreme violence or pending case that is a crime of violence, they must provide to us an affidavit, and there is an appeal process for our team to actually review the application and say, is this individual a good fit for us, or is another program a better fit, and can we meet their needs? That's the general application process. I know I've gone very fast and there's probably tons of questions, but I'll segue to Jen so that she has time as well. But I will say one thing before going is, you know, why we started, and I'll just say I'm a dyed-in-the-wool public defender. We did this to save lives during COVID. Our people had no sheltering whatsoever in our community. And not only that, but I'll just share from my public defender years is the number of our severely mentally ill individuals who have committed suicide in jail because there was nowhere to go and they could not make it out on bond. Our goal, if safer, is to save lives and to save lives during COVID. And I just want to do a shout out for all our partners that are listed and not listed on our presentation. But for them, our people would not be alive today. And we did this on hands during a time period where our whole community was shut down and doing everything virtual. And we were all hands on deck during this time period. So major shout out to my entire team.
Thanks, Gina. I think that is really grounding in what makes us want to move forward in this work. We're going to get to look more into those life-saving measures and what our new goals are according to the data in a moment with Adam. So I'll go quickly here because what he has to share is, I think, very exciting. But on the screen right now, you see a number of our partnerships. These are some of our lead partnerships, but we're always open to looking into deeper and more meaningful ways to partner for the sake of the participants in the program. And you imagine that because of that referral process, essentially everybody who comes into the SAFER program comes in with at least one partner. Maybe that's their pretrial mental health service, another partner for the community, so that we're already beginning to build that community around them that can help them with, for example, reentry. If you were to come to Safer today as a participant in the program, you would get to be walked alongside by our amazing staff who will help you with housing and case management and do therapy right on site. But we also get to work with these awesome partners. So you'll get to meet our peer, who's going to be the person that gets to kind of wrestle with some of the day-to-day questions you might have and help discern with you what your own goals for your own life look like. And that is done alongside our staff as well. You have the opportunity to work with mental health and inclusion ministries with a chaplain whose specialty is mental health. And then on the other side of the screen, you'll see that if you were a participant today, we'd make sure that we got to connect you also with further support for your mental health, additional programs, and then we're also looking more and more at physical health. Gina tells this powerful story to staff about a participant in the program who you could support in their sobriety and you could support in their mental health, but so often somebody who's been in and out of the system or been on the streets has totally forsaken their physical health because you don't have the capacity to take care of your physical body, or maybe you're afraid of going to doctors or dentists. And so Gina tells a story about really a life-saving moment for a person who had diabetes and didn't have it diagnosed, and that staff worked around the clock to visit that person in the hospital and help them do well in that space. And that person is doing well today and is still connected to our program, no longer as a participant. So that's where organizations like Stride and the Worth program at Anschutz really matter to us, because they bring in that primary care and medical peer support. So if you came into the program today, these are some of the things that we would offer to you. And I want to just lift up one other small example of something that I'm seeing right now that's really powerful. And that's we have the honor of getting to work with people who have been on the competency wait list. And both because of the actual struggles that they have, but also their situation, they have certain vulnerabilities that are really unique to themselves. And I'm thinking of one woman in particular who right now is engaging with Neurocraft, our partner. So they do neurofeedback and they'll do a brain gauge to see how your brain is operating right now and let you see your progress over time. And for somebody who has heard the word incompetent in reference to her own self, to have a time during the week when somebody just talks to her about how beautiful her brain is a part of her healing in our program. So I just want to, and that's before they're even doing the work, right? So just we're really thankful for the beauty of our supportive partners and the beautiful backgrounds in science and expertise that they have and bring, so that we can all really do wraparound services. In addition to that, we host groups on site. P2P allows us to have a meditation group on site. I get to host a group tonight about how to continue doing well in the program. So if you have any beef with our rules, you get to hash it out with the assistant executive director every Thursday. We go to Live Different, and that's in conjunction with Cross Purpose. We have mental health groups, resource groups, where you do everything from write your resume to start tracking your budget so that you are set up to thrive when you leave our program. And when you leave our program, our staff and our peers get to stay with you. So that's just a broad brushstroke of what would happen if you got to come into the program today. Go ahead, Adam.
Thank you, Jen. All right, so I just wanted to take a moment to look at some data points. We've had some ongoing conversations surrounding, how do we define success for participants entering the SAFER program and moving through the SAFER program. And honestly, to us, we really see success in getting them housed and getting them off the street, and also just reducing their recidivism, reducing law enforcement interactions. And from that perspective, we really see ourselves having 99% success rates. We've only had 3 participants receive new charges while enrolled in the program. 2 of those were during 2020, actually. So with the incorporation of wraparound services, we've only seen really 1 individual recidivize, which is really pretty amazing. And another stat that we're very, very proud of is we've had 0 overdoses on site at our program. So just very proud of that and hope to continue that level of care and wraparound services from all staff. In total, we've served 166 participants since the beginning of the program, with 7 program reentries. So if for whatever reason an individual may need to go to detox, they can always re-enter our program. We always offer the opportunity to re-engage with SAFER. As you can see, we've had almost a third of participants intake into SAFER without any medical insurance. We've had a little over half of all of our participants arrive without SNAP or food assistance at all. So those are two of the things that we address immediately upon intake as far as basic resources. So anyone entering the SAFER program is going to get connected to those services. As far as total placements, so that would be moving on to kind of a next step housing as we'd see it. We've had 93 individuals move on, and some of those locations where they'd be moving on to can look like a private apartment, sober living program, reintegration with their family, or moving on to a higher level of care than we can provide at the hotel. And now that we've actually been able to have these housing navigation trainings and have a staff member that's focus is landlord recruitment and housing navigation, we really only see that as improving our outcomes as far as housing going forward. We're going to be able to develop relationships with specific landlords that work with our people essentially. The average length of stay for participants is around 79 days, and that can range from, back to emergency sheltering one night to over 200 days or over a year also. And like I said, our success rates have only improved with the incorporation of the wraparound services. That includes the peer support staff and the on-site clinical care. As you can see on the graph here, we've been able to increase our capacity as well with those wraparound services. And these successful stays, that includes participants that were still actively engaged with the program at the end of each year, as well as the individuals that moved on to Next Step Housing over the course of those years. And just a quick look at our participation demographics here. As you can see, the majority of the individuals that we're interacting with are white males between the ages of 30 and 39. We do strive through the application process to create as much equitable access to our program as possible by prioritizing persons from marginalized populations, as well as veterans. And I just wanted to highlight basically we survey at the intakes for participants, basically their perceived reasons for housing instability. And as you can see here, this is just ranked out, the most common being their substance use, employment instability, mental health care needs, and justice involvement. I also just kind of wanted to highlight, as an aside, just some significant things that we have learned over the course of these years working in SAFER. And that's really just, again, to reiterate the importance and effectiveness of our on-site wraparound clinical services and getting these people connected with the care that they desperately need. The importance of specialized housing navigation and landlord recruitment, which we have really high hopes for in the future, and just developing those relationships, as well as the importance of our connections and partnerships with ancillary services that just fill the gaps for us, because we're working out of a hotel, so we have a limited capacity. So really our partnerships are so crucial to the success of our participants. And just lastly, the substantial need in our locality for permanent supportive housing for our high needs individuals. So with that, I'll open it up to questions. And here's our contact information as well, if anyone has any specific questions that they'd like to ask. But if anyone wants to jump on and ask anything, please feel free.
I'm going to add a little thing, kind of segue. This is regarding what Adam said. I think it's critical for us to understand the housing crisis Colorado is in. And for one of the things that we learned is that our people can be on permanent supportive housing waiting lists forever. And if we relied on that alone, they would die on the streets or be re-engaged in the criminal justice system. The other thing we learned is that because a lot of our people coming out of jail, the present VI SPDAT, which is the instrument to rank people to see if they qualify for vouchers, is not criminal justice and mental health sensitive for our population. And 3, even when we do stabilize our participants and our participants rocket, in terms of working and restabilizing, they have too many evictions on their past history, or their criminal history precludes them with landlords. So our landlord recruitment and learning is just that, recruiting individual landlords and getting them and building their trust to take our people, and us continuing to respond with wraparound services to keep them housed is a critical piece of what we're growing towards.
I'll add, I don't see hands up, so I'll add that we see one of our next most important growing edges as growing relationships to do better in reach into the jails. We're able to do pre-screens and things, and a lot of our referrals are connected to somebody who's in custody at the moment, but we really do want to increase our in reach. That's on our docket.
All right, well, like I said, our contact information is right here, so feel free. Thanks so much, Sonia. Oh, are you all collecting data on this?
Yes, so that's really a Adam question, but I just want to say, like, yes, we have to really discern if we're saying no to somebody, we have to be able to really, I mean, just like Gina said, this program started out looking to collect data. So that kind of counting our no's is also really important for us. Thanks for asking that. Adam, you can say more to that, I think.
Yes, so I do, as far as every application that we receive, that is gathered.
There, I had a few questions, if that's okay. Sure. Hi, I'm Zach Lamuto. I'm a forensic navigator for the forensic support team for CDHS. I'm working in Jeffco as a navigator, but I'm transferring over to the 18th pretty soon. I'm going to be doing, I'm going to be doing navigation mainly in Douglas, Elbert, and Lincoln. But I'll be doing psycho-legal education, pre-restoration education in the Arapahoe jail. So I'm going to be doing a little bit of both. With that being said, I just had a question about the services, which sound really awesome. I know we were talking about Arapahoe County, but would this, could any of this be helpful for folks in Douglas or in, Elbert or Lincoln as well? Just wondering how far the bandwidth is for these services with clients there. Thank you.
I think that's a question I'll take. So we have served approximately 4 clients to date from Douglas County.
Mm-hmm.
And that is because of my connection being a public defender in the 18th for so many decades, and my past colleagues reaching out to me, as well as our partnership with All Health. So All Health serves Arapahoe and Douglas. And so a lot of our people also will have Douglas and Arapahoe cases. So the answer to that is yes, we have actually been strategizing to say, what is our bandwidth to include Douglas? And I'll just say, I'm always looking at what does it look like to expand, and do we collaborate with Douglas? Since I can say this because I live in Douglas, they always may be able to help, but they don't want it in their backyard. Are they willing to use some of their ARPA dollars to help us expand if we were to improve that relationship? And I think it's more of Elbert and Lincoln. The biggest problem there is the distance and a different mental health center that is not related to us. And I'll just say, the thing that we're still looking at growing is, I don't know if you're aware of, and this is just my legal hat, is come a year and a half, Douglas County, Elbert, and Lincoln is going to be its own judicial district. So I don't know nuance wise what that means in terms of even funding through the state because of that. I'm assuming until they get up in speed, they're going to be doing a lot of contracts still with Arapahoe County. So I'll just say right now, I think Douglas is doable depending on different things. A lot of our funding right now is there clearly needs to be at least some kind of contact with Arapahoe, since so much of our funding comes through there. So encouragement to Douglas to collaborate with us and help fund some of that. And I would say yes, even more so.
Right. No, thank you. Yeah, I know it's the new 23rd, like end of the year or something like that. So we'll see what happens.
But feel free to contact me because we have
Yeah.
some already for people from Douglas.
Definitely. Yeah, I took a screenshot of all the contacts. So I will be doing that in the near future once I figure out my transition. So thank you so much.
Thought there was someone else had a question.
I'm going to follow up on mine, Sonia. So with that data of the people that can't be served, where does that go? Sorry, because I'm always looking to house the people that fall through every crack. So.
It hasn't gone anywhere at this point. We've just kind of been gathering it. I think we've included in some grant applications to hopefully get us some additional funding. We see a lot. I mean, we're seeing a substantial amount of individuals who are really Denverites, who are looking to get housing services and are being referred to our Arapahoe County program. Basically, there's just, so we were hoping to get some potential Denver funding, basically. I don't think that panned out, unfortunately, but we haven't done anything specifically with our non-admitted data just yet.
I think oh, sorry, we're all jumping in. That's a really great opportunity for collaboration, right? Because we would like, if that's valuable information to you, so that we hate turning people away for like the things that disqualify somebody from our program, like really stress a higher need too. So that just sounds like an open door for collaboration for us. We would be delighted to support you in any advocacy you're doing, or to find a way to partner or to increase our ability to serve higher acuity, higher complex needs.
And I think that's, and let me jump in, kind of segueing off of my two, coworkers, and that partners in crime, I like to say, is exactly. So we did apply for Caring for Denver because of Adam's awesome data. We were able to show that 70% of our people had connections to Denver, and actually probably considered some of their stuff more associated there. And we were not accepted in that grant because we were an Arapahoe program, despite who we were serving. And two, we have reached out, and I saw Lynn on, I don't know if she is still on, but in the beginning, we really were saying no to people because we couldn't meet their needs. And that's where you actually see us as we grew with our on-site staff and clinicians. And we are now taking that next jump that we had previously in the beginning said no to people that had competency raised. What is that? We are looking and drilling down is, what is that person who has competency raised or have been found incompetent to proceed, who can be safely sheltered by us and walk alongside of them. So I think as time goes by, we're going to increase that. But what does that look like? What is that additional support that they need? And I can give you a perfect example. One of the women that we took, who has been referred to, is phenomenal, but her incompetency, at least in part, relates to her attention span. So for us to engage her and having a peer, so I'll just say that the catch-22 in our arena to get Medicaid reimbursable and become a Medicaid provider is, so our peer working with her can only bill 10 hours a week. With her attention span, just to get her food stamps took about 10 hours in and of itself, just because of working around her difficulties and attention span and finding different information out. So everything is like 2 to 3 times as long. So how do you build that in, and how many individuals staff-wise can you take at a given time if that's an issue? So it's we are looking at it in that regards. So hopefully we are learning ourselves, at least internally, what do we need to add for supportive services when those things are preventing us from taking more people with higher needs.
Oh, Sonia asked, we see a pattern of diagnosis in people who are at higher acuity, not able to be served appropriately in our program.
Can I take that one, Adam?
Yes.
So I'm the newest member of the three of us. And what we actually see is that people are oftentimes not diagnosed. And so people regularly coming into our program only have a diagnosis of anxiety and depression. And so we even have circumstances where like the criminal record or other information that comes through in the application really demonstrates that their mental health needs a better assessment. And depending on the rest of the information that we receive, we can try and bring somebody in and do that assessment. But if there's not enough clarity on that, and the history of that person looks like the acuity level is too high, we only can go on that. And so one of the biggest issues that I think, I mean, you all know this across the board, right, is that people are underdiagnosed. And so it's hard to, for us, we have to protect that milieu, the group of individuals that we have. And so when it's a question about safety, for example, like if somebody's done something violent, then we have to be able to assess, okay, is it safe to bring this person on board? But I would say on behalf of my team that is the question that comes up when we're looking over an application is, do we think we can bring this person on board safely? And that's our only boundary. But really, you know, when we see a diagnosis of schizophrenia, for example, we're thankful for that. That helps us know that we have the tools to walk alongside that person. It's when there's not an appropriate diagnosis that we have to gamble more.
I'll also take the hard one, and I'm sure it's the elephant floating in the room. If we know the person is a paranoid schizophrenic and is a person who does not accept or acknowledge their mental health issues, another mental illness because of not accepting it, but are not med compliant, and they've had a repeat history of violence, we can't do that. We don't have that staff level. They can't move forward. So we are, and that's what we're saying earlier, like who are the people that we can help with the severe and persistent when they want to have someone walk alongside of them. Because
I also just want to,
yeah, sorry, go ahead.
Just want to note for the question in the chat too, yes, if somebody is doing any kind of competency restoration, they can absolutely do that while in our program, and we prefer it, right? So that, like the woman that we referred to a couple times in this, she's doing restoration. She actually had court today, went well. So we want to be able to be a partner to you in that. If you've got somebody that is doing restoration and you can't do restoration from the streets, right? I mean, that's part of the whole gamut. So yes, that's a core, that's a core impact for us. Mm-hmm.
But also the other side to that for everybody too is, for example, they wanted her to do restoration across town that would have entailed 2 bus rides. And yes, SAFER has the advantage of having 2 vehicles, but when we are taking people to court, to medical appointments, and those restoration classes are twice a week, it was a setup for failure to her. And so that restoration entity was phenomenal. We said, we will provide a room, we'll provide privacy, and they're coming to her. And she would have gotten lost. She would have been gone, you know, if she had to take 2 buses. So
At this point. Yeah, we look forward to telling you her story again in a year.
All right, I think we've gone a little bit over time. Thank you so much for joining today, everybody. We will see you again next month for another presentation. I appreciate you taking time out of your Thursday. Thank you.
Thank you all. Appreciate it.
Absolutely.
Thanks, everyone.
Mhm.